Hey, it's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. How you feeling today, my friends? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. You can't ask for better than that. Hey, we got a good one for you today. We're talking about what are the disadvantages of marijuana use for people with diabetes. Hey, this is a good one. So sit back, relax, and listen to what David has to tell us about this. You're going to be interested in this one.
What are the disadvantages of marijuana use for people with diabetes? Using marijuana might provide some benefits for people with diabetes, but the drug also has its drawbacks. Marijuana affects the developing brain, potentially impairing learning and memory, so people under the age of 25 years should avoid it. If cannabinoids can affect the metabolic system, insulin sensitivity, and appetite, this might mean that frequent marijuana use could disrupt these functions. We'll consider some other possible problems. High blood sugar. The main disadvantage of using cannabis for diabetes is that it can lead to an increase in appetite. Some people refer to this common side effect of marijuana use as the munchies. The drug may cause people to crave and eat large amounts of carbohydrates. Using marijuana and being high reduces a person's ability to make the best choices. An increased appetite can be especially problematic for people with diabetes because carbohydrates cause a spike in blood sugar levels. Very high blood sugar levels might result in a medical emergency. Low blood sugar. Abnormally low blood sugar levels can also be dangerous for those with diabetes. Low sugar levels occur when the blood contains too much insulin and not enough glucose. Symptoms of low blood sugar include shaking, sweating, rapid heartbeat, confusion. Intoxicated marijuana users may not notice that their blood sugar levels have dropped. They may mistakenly attribute symptoms of low blood sugar to marijuana use, meaning that they could miss signs of a potential health emergency. Other potential adverse effects of marijuana use include addiction, which may develop in 9% of adults who use marijuana recreationally. Faster heart rate, interactions with prescription or over-the-counter medications, breathing issues, dizziness, withdrawal symptoms, slower reaction times and the inability to safely drive or operate machinery. Problems with concentration, learning, and memory. How the person uses marijuana will affect their risk of adverse effects. Smoking marijuana will have a different result than medical preparations that a doctor recommends. As the FDA have not approved the use of marijuana or its compounds for treating diabetes, a person cannot be sure of the ingredients or quality of any product that they obtain. It is essential to speak to a doctor before using any form of marijuana or other complementary therapies to manage diabetes. Some studies have investigated the effects of using marijuana products to treat specific symptoms or risk factors of diabetes, such as nerve pain, inflammation, and obesity. However, the results are contradictory. While some studies have shown an improvement in symptoms, the FDA have not approved any cannabis-sourced products as being safe or effective for the management of diabetes. Some topical CBD and THC products that are available in spray form might provide benefits for people who have diabetic neuropathy. It is vital that people treat all cannabis products with caution and only pursue a course of treatment on the advice of a medical professional. I hope you found this information helpful. Now, I'm gonna pass this back over to Jimmy.
Thanks, David, and thanks for that information. That was useful. And I want to thank you, the listener, for being here today. Here's something else. I want you to go over to Living with a Disability, our group page on Facebook. You can get there by going to www.famousapple.com/group. Don't worry, that information will be in the show notes for this episode. And join in the conversation there because we're going to be talking about legalized marijuana and your opinion about it. So join in the conversation there. I'm curious to see what you think about it, see what other people think about it. So it should be a lively conversation. Make sure you go over there. It's www.famousapple.com/group. and give your opinion and join in other conversations while you're there. People are chatting, they're talking, they're having fun, so you should too. Join us over there. And again, thank you for being here today. Make sure you stop back again tomorrow, because we'll be back again at 4 a.m. tomorrow with a new Apple Fritter, where they're 5 days a week. Every morning, 4 a.m., there's a new one out. We're up early in the morning working on it. We're like the elves. So join us every day. And I want to remind you, no one ever went blind by looking at things from the bright side. So give it a shot, my friends. Look at things from the bright side. And here's your homework for today. Be the reason somebody smiles. You'll be surprised how good it makes you feel when you make someone else smile. And remember this, no matter what, things can always be worse. That's right, someone somewhere right now is wishing that they were in your position, so things can always be worse. Hey, you've been listening to an Apple Fritter. My name is Jimmy Apple, and I'll talk to you again tomorrow. Have a great one today, my friends.
Join Jimmy tomorrow for another Apple Fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.